another Facebook Live broadcast. My name is Sarah King. I'm the founder of Invigorate Physical Therapy and Wellness, a Parkinson's physical therapist. And at Invigorate, I am centered around helping empower you with the knowledge you need to create your own Parkinson's plan of attack so you can slow the trajectory of the disease as much as humanly possible and also live a life full of energy and vitality despite your diagnosis. And I'm so excited to bring you today's guest. Dr. Bas Bloem is one of the most sought-after movement disorder specialists in the entire world, and he's here today to chat with us about not necessarily his clinical skills, which I know are top-notch, but actually about a creation that he has started in the Netherlands called Parkinson Net. It's an award-winning healthcare concept, and it's fairly new, but incredibly simple. So I am going to bring him on here in a second, but just to give you a little bit of a background, Dr. Bloem is a professor of movement disorders at Radboud University's Department of Neurology. He's the medical director at the Parkinson Center of Nijmegen, which was recognized from 2005 onward as a Parkinson's Center of Excellence, Parkinson's Disease Center of Excellence. He's active in the Parkinson's research community. He's published over 700 publications, over 500 of which are peer-reviewed international papers, and has won numerous awards and serves on lots of boards and committees that, if it's okay with him, I'm going to pass by today just for the sake of time. But I'm going to bring him on today, so say hello in the comment section below. And if you've got questions for Dr. Bloem as we go along, you can put them in the comment section too, and we'll make sure to circle around to those at the end. So let's go ahead and welcome Dr. Bloem. Thank you so much for being here. How are you doing today?
I'm very well. Thank you for inviting me. It's a real pleasure to be here, Sarah. Thanks.
Absolutely. Absolutely. Well, I know you could easily talk for hours about Parkinson's approaches and treatment programs and kind of the nitty-gritty of Parkinson's treatment. But today I actually really want to focus on the future of Parkinson's care. You have a lot of experience over the last 15 to 20 years in movement disorders, in Parkinson's, and have transitioned to this point where you're really trying to reshape the way that we provide Parkinson's care. So if you wouldn't mind talking to our audience about Parkinson Net, what it is, why it's important, how it got going, and your involvement in it.
Sure. So ParkinsonNET was founded some 14 years ago in the Netherlands. So it's new, but it's not brand new, although we continuously keep to innovate and improve and change things. ParkinsonNet was really founded because we felt that Parkinson's is such an incredibly complex disease. It's different between individuals, the treatment is complex, and you really need deep expertise to be able to treat patients right. And at the time, in 2004 in Holland, a typical physiotherapist, for example, treated maybe 1 or 2 patients each year. There were no guidelines. And patients were receiving maybe a weekly massage, which they felt, was nice, but it wasn't doing much to improve their gait or their balance or other specific problems for Parkinson's. So we decided to begin and train a limited number of professionals, give them a 3-day intensive training according to the latest scientific evidence, and then make these people visible through initially printed brochures at the time, but we now have a web-based healthcare finder where patients can say, I want a physiotherapist, I want to travel 12 miles, and then Google Maps will give you an overview of the people fulfilling those criteria. You can benchmark them as if you're buying a fridge. You can look at their photos, you can see where they work, and then patients decide whether they go and to whom they go. So not only do we make these experts better by training, we also concentrate care among those experts so they treat more and more patients and become better and better. That's one pillar. The second pillar is educating patients, which is exactly, Sarah, what you're doing here today, is bringing knowledge to patients. And one of the things, and the folks that are listening to this, that I really recommend is Parkinson TV. We broadcast in Holland, live television, to patients once every month. And we now have 10 episodes in conjunction with Ray Dorsey in Rochester, a wonderful neurologist in the United States. They're all on YouTube, 10 episodes in English about real-life issues that matter to people with Parkinson's. Because we strongly feel that an educated patient is happier, healthier, better able to self-manage, and eventually cheaper to society. That's obviously not the primary goal, but that will help to make healthcare affordable for our future generations. And all those episodes of Parkinson TV can be found on YouTube. And then the third pillar is effective collaboration. Patients and professionals should work together as a team, seamless integrated care. And those three components in the Netherlands, and that leads in the Netherlands to better care, better outcomes, fewer hip fractures, fewer admissions to hospital, and substantially lower healthcare costs. And we save about up to 30 million euros each year on Parkinson's care alone by building these networks. And that's really impressive, I think.
Yeah, that is definitely impressive. I think I said wow aloud, because obviously in the United States, we're facing a lot of the same issues. A lot of the clients that I'm sure are watching that have a Parkinson's diagnosis feel like their care is really discombobulated, and they go to see one specialist and then another, and their physical therapist and their speech therapist, and it's very disjointed. And also time with practitioners is limited. Unfortunately, the people who need the greatest care, it seems like, have the least amount of time with their practitioners nowadays over here. And also the education piece. You know, a lot of in our healthcare system, we don't have time to educate every single person that comes through our door because you're busy seeing more and more patients. And so when I heard about Parkinson Net, I was really blown away. And I know it's been something you've been working on for a long time. But it seems like it has to be the way that our healthcare shifts, not only to help us save money, but also to give people the care that they're looking for and also empower them. So can you speak to a little bit about who makes up the Parkinson's team inside Parkinson Net? Who are the primary people on an interdisciplinary team that someone diagnosed with Parkinson's should start to kind of form around them if they're not in your system quite yet?
Yeah, so the Dutch Parkinson Net started with physiotherapists because this is where the greatest need was at the time, because there were many physios in Holland and each of them were treating just a few patients. But after we started training physios and were very successful, we actually started to train occupational therapists, speech and language therapists, dietitians, nurses, neurologists, geriatricians, nursing home specialists. And we've now trained over 12 disciplines. If I was to make recommendations to any new network, for example, in the United States, I would definitely say start with physiotherapy. That's key for every patient. Dietitians are key. Many patients with Parkinson's have constipation. There's interaction between medication and food. There are various lines of research now pointing towards possible disease-modifying effects of food. So a good dietitian who understands Parkinson's is key. And sleep. The sleep expert is also really essential for people with Parkinson's. But end of the day, in an ideal world, you have this whole army of people from maybe over 30 disciplines. And that doesn't mean to say that each patient needs to see these 30 disciplines. Thank God they haven't. But if needed, you should be able to pick an expert if you have a dedicated problem in a specific area. And the number of 30 is not arbitrary. On my last count, there are at least 30 professional disciplines that have real added value for people with Parkinson's.
That's wonderful. I know that you have written a lot of articles, and I think I've read a few of yours that dive into that a little bit deeper. So there will be a corresponding blog post for everybody that's watching. You can find that depending on when and where you're watching it in the description around this video, above or below to the side. So we'll make sure to list a bunch of resources over there on the blog so that you can dig deeper into some of these topics that Dr. Bloem is talking about. So as far as the education piece, I like that you mentioned Parkinson TV. We're going to talk about that a little bit later, but for those of you who are watching, if you enjoy these types of broadcasts, check out the YouTube channel. I think it's a group out of New York. I can't remember the nonprofit. Could you tell us which nonprofit? I think if you just search in YouTube, Parkinson TV, you'll find the series, and that's an amazing resource for people. That's what we're trying to do here as well. But how do you, outside of education, how does Parkinson Net structure support outside of the hospital system so that people don't have to always come into the hospital to get the care they need? How do you guys kind of reach them where they're at?
Well, that's, even in Holland, that's still an ongoing challenge. So you have to know that ParkinsonNet in Holland is, by and large, it's a community-based network. So in Holland, we have many physios and OTs and speech and language therapists working in the community. So we also train people inside the hospital. But in fact, one of the strengths of the Dutch ParkinsonNet is these people working in the community, close to the patient's homes, that by offering good treatment, can avoid visits to the hospital. They can make visits to the patient's house, which I think is critical. But ParkinsonNet in its current state is in that regard still insufficient. And we just had a press release to announce that we've received a 10 million euro donation from England, which is incredible, to build what we think ParkinsonNet 2.0, where to this allied health network, we are going to add the deepest wish of Dutch Parkinson patients. And I'm convinced American patients are no different. And that's to have one person who is your single point of access that you can address at any point in time that you like, who will answer simple questions for you directly, or if that person cannot answer the questions directly, will navigate you through the jungle of healthcare, which for many patients literally is a jungle. They have no idea where to go, and to say, for this particular problem, you need the combination of a physiotherapist, and this is where he works, I'll book you the appointment, and a dietitian, and that's where she works, and I'll arrange that for you too. And that single person, who we now label the Parkinson coach, that coach will then also supervise the team, much like a director for an orchestra. Because oftentimes, many professionals are involved in Parkinson care, but they have no clue what the other guy or the other girl is doing. So the coordinator is your first point of contact, solves simple questions, directs you in the right direction, and coordinates your care. And I think that holds tremendous promise for the future of Parkinson care.
Yeah, I think what you're describing is something that's taking off, I know here in the States, which is concierge medicine, where you have that one person who is dedicated to you, that takes a limited amount of patients, who can spend time with you, going over your history and really being that point of contact. But that's, I know people are watching are probably drooling hearing that, because it is really confusing. Like you said, they could have entered the system at 30 different spaces, 30 different practitioners who see Parkinson's diagnoses. And so getting tossed around, some people have 3 appointments in a day, and all of them are telling each other different things to do, different strategies. So I think that that's Parkinson Net 2.0. Is that what you're calling it?
Yeah, exactly.
I'm excited to see how that goes. So I know that you've been talking about the Dutch Parkinson Net, and that's where this originated, but not too long ago, you guys had, well, maybe it is a while ago, transitioned into the States through Kaiser Permanente and potentially other partners. I'm not sure where you guys are at on those projects, but for people who are in the States watching this, where can they keep an eye out to see where Parkinson Net is emerging? How can they get involved?
So Kaiser Permanente, as most people will probably know, is a huge American, California-based healthcare organization, which in many ways is interesting because it is a healthcare provider and a healthcare payer in one organization. So they have a vested interest to deliver the best possible care to their clients and at the same time keep the costs within a controllable range. So when they heard about ParkinsonNet and all our evidence to show that ParkinsonNet leads to better care and lower costs, they've asked us to implement ParkinsonNet in California. And the good news is, even though America is a different country and a different culture, and even though Kaiser has a different healthcare system, we were able to install the effective ingredients of the Dutch ParkinsonNet into the Kaiser Permanente system. I've come to realize that we're a little bit like Starbucks. If you go to Starbucks, they have their coffee beans, milk, and a mug. And maybe you want your double espresso, and I like brand. So with same ingredients, you can tweak the coffee to your likings. Our basic ingredients is not coffee beans, but it's professional education, patient education, and effective collaboration. And even though Kaiser is organized differently, we were able to introduce our training programs for the professionals. We were able to introduce our teaching programs for patients and teach them how to work together as a team in a different culture and a different system. And we just submitted our first scientific paper to show that, again, we're seeing positive outcomes in California. And right now, there's also a network in Rochester, New York State. That's a partnership with Ray Dorsey. And we are having active conversations in Michigan with Professor Patrick Brundin in Grand Rapids to bring ParkinsonNet also to the Michigan state.
Yeah, slowly but surely taking the United States by storm. Well, those are good, both coasts and right down the middle. It seems like at least people who are watching in the States have, I know that you can't necessarily go there for all of your care, but I was curious what you would recommend to people who are not in California, not New York, not in the Netherlands, not in Michigan, for people who are watching who are thinking this sounds really great, but maybe they don't have this type of system built around them. What do you recommend to them as far as how to organize their healthcare for themselves, how to take control, maybe to try and implement their own Parkinson Net? Do you have any strategies or any tips about patient-centered care from where they're at?
Yeah, sure. So I realized that by telling people about how we develop ParkinsonNet, people might also say, oh, gee, we don't have this in our own environment, and am I receiving less than optimal care? I think the good news is most people in healthcare are very passionate and committed to help people. The few strong recommendations that I would give to folks on the line is to make yourself as knowledgeable as possible. So a program like Parkinson TV, the education programs of the American Parkinson's Foundation, the Michael J. Fox Foundation, there are various organizations in the United States that can bring you deep knowledge. So make yourself knowledgeable, participate in research, and travel the extra mile to find the expert. And if you don't have an expert maybe nearby every day, just make sure that at least once a year you travel the extra mile and see that expert, and actually demand that that expert at least reaches out to the local people living nearby your house to implement your plan. So I've often told people, so this is actually how it works in Holland. I've oftentimes said that I'm the Jamie Oliver, the famous English chef. I'm the Jamie Oliver of Parkinson's care. What I do is I see lots of patients for secondary, tertiary referrals. And I see these patients, I spend a lot of time with them, and then I write a little cookbook, a recipe. And the recipe is going with the patient to the local physician or the local PT, the local OT. And as you know, with Jamie Oliver's cookbook, you can make a brilliant pasta. And Jamie Oliver doesn't have to be in your kitchen to make that good pasta. So with my cookbook, the local chef can build a good Parkinson recipe and help patients better. So make yourself knowledgeable, participate in research, and find that expertise at least once a year, even if it means traveling.
Those are great tips for everyone. I like a couple things about that, but number one is you said the word demand, that someone essentially follow through on coordinating your care. And I think a lot of people have a little bit of a reservation when they're speaking with a healthcare provider, especially, a physician that they've had for a long time. They feel like they maybe can't ask them to connect them with a provider or really step into the place where they're empowered and say, I really need this from you as my healthcare provider. They're the one to really not force the issue, but to really demand that their healthcare kind of comes up a notch. And I think a lot of people are a little hesitant to be that person that.
But can I just say one thing about that?
Sure.
If you're refurbishing your house and you have a plumber and a carpenter, people have no hesitation in demanding that these people have expertise. You will ask the plumber, have you plumbed a house before? And did you speak to the carpenter about who does what next? Now, this isn't your house. This isn't your rooftop. This is your health. So the old idea of doctors as gods and you as a dependent client, and I realize when your health fails, you're in a dependent position. But at the same time, I think it is perfectly normal that you as a patient can expect your physician to take you seriously, give you patient-centered care, and to make sure that he reaches out to other people in your team to collaborate. And I think that would be my additional piece of advice to patients, is to step up. It's your health, it's your body, it's your life, it's your family, it's your spouse that's at stake. And I think it's perfectly normal that you ask your physician in a friendly way, but decisive, to give you the best possible care.
Friendly but decisive. Let's just have that be our take home. Friendly but decisive, for sure. Okay. Tell us a little bit more about Parkinson TV. You're in second season now. So the first season was excellent. I watched all the videos. And again, if you're watching, we'll link to Parkinson TV in the description around this video. But tell us a little bit about what season 1 was about and now what you guys have covered in season 2 so that people can tune in and learn a little bit more.
Yeah, so Parkinson TV it's something what we're doing today. It's a web-based, interactive, in Holland it's interactive, in the US it isn't interactive, but it's an informative web-based television program. And it's a talk show setting where there's always a patient at the table, there's a host, chair, there's a sidekick, I'm always the sidekick, and an additional expert on the very topic that we're talking about. And episode 1 was about exercise, it was about diet, it was about occupational therapy and assistive devices, and all sorts of really practical issues. Season 2 was about the mental aspects of Parkinson's disease, depression, apathy, psychosis, and the like. And they were all extremely informative. I hear it's been received exceptionally well in the United States, and I heard from Ray Dorsey that season 2 now receives up to 500,000 viewers. And imagine, I can speak in my consultation room to you one-on-one and explain to you about diet and Parkinson's. Then my next patient comes in, and it's as if you put a record on, and I repeat the same story. Now, with the same story, we reach 500,000 folks. That doesn't mean to say that it covers all of your questions, but I recommend that folks watch Parkinson TV, and then you can take your residual questions that apply to your personal situation so that you make the most out of the sparse minutes with your physician.
Great feedback. And if you are watching, you can give this video a little thumbs up if you've seen Parkinson TV. It's incredibly well done. Like Dr. Bloem said, it's great to as a patient, be educated, learn about some of these topics, and then be able to go in and have an educated conversation with your healthcare provider so that when you show up, you can actually participate in the treatment options and have a informed conversation with your healthcare providers, because a lot of the times we do find ourselves as healthcare practitioners repeating the same things over and over. So hopefully even this interview can be something that people can watch and then seek out Parkinson Net or, other resources and find themselves informed. So thank you so much, Dr. Bloem. Is there anything else that you maybe wanted to talk about that you didn't have a chance to talk about here?
Well, there's always so many things to say. Exercise regularly is something that cannot be emphasized enough. I always tell my patients, do something every day. And I tell my Dutch patients, tongue in cheek, half jokingly, you don't have to cover yourself in a pink spandex suit and go to the gym. Something after what you do can be brisk hiking, could be swimming, could be cycling. As matter as you bring your heart rate a little bit up, you should be a little bit short of breath, but still be able to maintain a conversation. And do that for 30 to 45 minutes every day. A walk a day keeps the doctor away. The second key thing is a healthy diet. Make sure that you have lots of high fibers, a Mediterranean diet, few cups of coffee a day, dark fruit with, like berries, or the darker the fruit, the more antioxidants. 2 to 3 cups of coffee a day is probably a good thing to do. So regular exercise, a healthy diet is really key. Optimism and hope, staying informed, and hopefully that'll help people with Parkinson's.
Yes, I can agree with all of those suggestions, obviously, and there are more videos about that on, I know, Invigorate's YouTube channel and also on Parkinson TV. If you want to dive into any of those topics, head over there, watch the videos, and they're incredibly well done and full of information. So hopefully, if you're watching this, you got a little bit more knowledge about the future of Parkinson's care. We're definitely going to keep an eye on Parkinson Net and Dr. Bloem as time goes on to see where this spreads and what this grows into. And maybe before we sign off, Dr. Bloem, can you recommend where people should go to learn more about you or the projects you're working on Facebook or on Instagram? Where are you at?
I'm in a lot of places. So people can follow me on Facebook, and I try to keep people informed about my whereabouts on Facebook. I'm also on Instagram, I'm on Twitter, and I'm on LinkedIn. And people can, but I usually post the same messages on all of those 4 channels. So if you follow me on one of those channels, you will be updated, including all the exciting new developments ongoing with the new large grant, also about our new ambitions to bring Parkinson to other areas in the United States, about Parkinson TV, and hopefully that'll help people.
Wonderful. Yeah. Well, thank you so much. And I know Elir said here, I always feel better after exercise. Thanks, Dr. Bloem, for your advice. I know a lot of people are checking in and saying hello in the comments. So thank you guys so much for watching. If you liked this video, give it a big thumbs up, share it with someone who could benefit from knowing more about how to take control of their healthcare program and learn more about Parkinson Net. And until we catch you on the next video, keep moving, and I'm sending you guys lots and lots of big hugs. All right, bye.
Bye-bye.